to our September PQA Quality Forum Webinar. My name is Amanda Ryan. I'm Director of Education here at PQA. Our topic today is careers and professional opportunities in quality. As we do with every quality forum, I would like to review a few housekeeping items here before we get started. First, as usual, please submit your questions to us during the presentation. You can use the Q&A feature that you will find at the bottom of your screen. Today's webinar format will be a little bit different than our typical quality forum webinars. We will not be using slides for the most of the presentation today. Instead, we will be having an in-depth panel discussion. So we encourage you to submit your questions throughout the webinar, and we will incorporate that as much as we can as we go. And then in addition to that, we will also have some time for some dedicated Q&A at the end of the webinar. Also, the webinar recording and the slide deck will be available to PQA members. That will be within the week following today's webinar, and you can find that on the member resource library section of the PQA website. Additionally, the recording will also be made available on PQA's YouTube channel. And then finally, I would like to encourage everyone to please take the quick 1-minute survey that will launch at the end of the webinar today. We always do appreciate your feedback. I'm pleased to introduce you to today's speakers. I will be very brief here though, since you will get to learn a lot more about them here in just a few minutes. First, we have Cassie Bobbitt with us, who is the Director of Government Programs Clinical Quality Analytics at Arkansas Blue Cross and Blue Shield. Next, we have Mary Beth Farquhar, who is the Executive Vice President of Research, Quality, and Scientific Affairs at the American Urological Association. Also with us is Hannah Lee Brown, who is the Director of Pharmacy Benefits at Healthfirst. And finally, we have Nicolette Mijas, who is the Senior Director of Emerging Initiatives at the National Quality Forum. Our goal today is to share a discussion with you about careers and professional opportunities in quality that reflect the experiences of professionals who might be in different stages of their careers and who have different professional backgrounds. We will discuss the fulfilling and non-traditional roles that are available to professionals such as pharmacists, data scientists, public health experts, and many others. As you can see on this slide, PQA is privileged to partner with member organizations across a wide variety of healthcare sectors. All of these organizations have a stake in healthcare quality in general and medication use quality in particular. You can see some very pharmacy-specific organizations here in this pie chart. Those include community pharmacies and pharmacy benefits managers. But as we know, medications are not related just to pharmacies. Organizations like associations, health plans, technology companies, universities, life sciences organization, and the government all have a stake in quality. And there is a focus on quality across the entire healthcare spectrum. So as you can see, PQA members are diverse, and they all come together to influence the nation's approach to medication use quality. In addition to that, these healthcare-focused organizations have a wide variety of quality-related opportunities for professionals in different settings and in different points of the patient care process. Today, we are going to have a discussion about some of these careers and professional opportunities in quality. So whether you are a student, or maybe you're more like me and haven't been a student for a while, we hope you find something to take away from this discussion about either pursuing a career in quality or perhaps adding more of a quality focus to your current career if that's something that you desire. As for us at PQA, we look forward to continuing to partner with you and with all of our member organizations on improving medication use quality. And with that, we are going to transition to our panel discussion. So I invite our panelists to turn their cameras on here so we can see everybody. Welcome. All right, first a quick thanks to each of our 4 panelists for being willing to join us today and have a conversation. So we're going to start by setting the stage to talk about each of our panelists' professional background. And Nicolette, I'm going to start here with you. Interested in your professional background and if you can tell us about how you got to your current position at the National Quality Forum.
Sure. Thank you, Amanda, and thanks for the opportunity to be part of today's panel. I'd be happy to kick us off. So I'm a pharmacist by background, like a couple other panelists. I received my PharmD from Purdue University. During my time there, I was also involved in research related to medication adherence and tobacco cessation. I minored in nutrition. So I really wanted to focus on a more person-centered view of health and a broader view of health and our healthcare system. I then pursued and completed the PQA fellowship, which I think exposed me to concepts of quality measurement in depth for the first time. Also had the opportunity to facilitate meetings with the Academic Affairs Committee, help lead a framework project on access to care and medications, which involved convening external stakeholders. A leader from NQF, or the National Quality Forum, was on the committee at that time, and that was one of my first exposures to NQF as an organization. And based on that experience, I knew I wanted to pursue focusing on healthcare quality more broadly from a systems-based perspective, which is very aligned with my role today as Senior Director in the Emerging Initiatives Department at the National Quality Forum, which I've been at NQF for a little over 4 years now. NQF is a nonpartisan membership-based organization that aims to advance healthcare quality and enhance the value of healthcare, and does so by endorsing quality measures, aligning measures that are used across different value-based programs, making recommendations that are used, proposed for use in different federal programs, as well as creating frameworks and guidance on quality improvement in emerging areas. So that's a little bit about my background to start us off.
Okay, perfect. Thanks so much, Nicolette. Hannah, similar question for you. Can you share about your background and how you got to your position now at Healthfirst?
Yeah, absolutely. And thanks again, Amanda, for having us. We're really excited to be here today. So I am from the Midwest originally. I'm a pharmacist by training. I went to KU, Rock Chalk. I slowly kind of made my way out to the East Coast after pharmacy school. And while I was a student, I figured out pretty quickly that a lot of the more traditional pharmacy career paths didn't hold a lot of interest for me. And so I spent some time exploring different government agencies and some other non-traditional spaces for pharmacists. And I feel like I kind of fell into quality almost on accident. I stumbled across PQA while I was on rotation as a student, and it just made a lot of sense. This idea of value-based care, healthcare quality. I think when you come from a clinical background, you want to do great things and help people. And so focusing on this space of value and quality seemed like a great way to do that on a larger scale beyond just individual patient interaction. So I ended up doing a fellowship as well at PQA. And while I was there, I got to explore this vast field of quality that I knew arguably very little about before going in, but PQA was so supportive in helping me to explore and understand how quality has a space in almost every sector of healthcare. So during my time at PQA, I had the great fortune of meeting a lot of really fantastic organizations and ended up taking a position after my fellowship in New York City with Healthfirst, who at the time had a leader within our pharmacy department on the PQA board. And so it felt like a very natural transition for me to go from this measure development space into the managed care space, where you take the measures that we've been working on and developing at PQA, and now we actually get to implement them in the real world. So when I first moved to Healthfirst, I started in a role that was really focused on Medicare. And now since I've been here, my role has expanded, and I have oversight of all of the pharmacy benefits for our entire portfolio of business, including Medicare, Medicaid, and commercial. And it's been great to be able to incorporate those things that I learned at PQA about quality into the work that I do every day as we serve the members of New York City.
All right, very good. Thank you, Hannah. One thing you mentioned is also one of my most favorite things about working in quality, is the ability to positively influence a lot of people at once with the work that can be done in quality. And a theme picked up from both Hannah and Nicolette here is connections from PQA. And that's also one of my favorite things about working here at PQA is the ability to make connections with such a wide variety of stakeholders. So thank you both for sharing with us. I'm going to move on now to Cassie. Cassie, tell us a little about your background and how you got to Arkansas Blue Cross Blue Shield.
Yeah, so first off, thank you again for allowing me to be on this panel. So I actually got a bachelor's degree in mathematics with a concentration in statistics from the University of Louisville, while I was also working at a local pharmacy. And I kind of made the decision that in order to help people in the holistic sense and not, you know, just the one person I was waiting on at the pharmacy, I wanted to get into something that would allow me to help a collective as opposed to an individual person, so that I could do the most good, you know, for the world. So I decided to go into a public health program. So I have my master's in public health from the University of Louisville. And then from there, I springboarded to working at Humana in the pharmacy quality space. And that is where I got connected with the PQA Alliance. So I was working on data. So I have a little bit of a different background related to data. I have medical pharmacy, you know, claims data, and I take that information and I put it all together and I say, you know, you're not compliant, you're compliant, what can we do to help? So that actually allowed me to get my role at Arkansas Blue Cross Blue Shield, where I now am involved in helping try to make those positive changes for our membership related to those quality measures. We identify who's, you know, struggling, and from there we go into the process of identifying what can we do to help. You know, what are we not doing to help our members get to that next step to become, you know, adherent to their medication or any of the other, you know, quality measures that are out there to ensure that the member is getting the best care so that we can prevent those, you know, comorbidities.
Absolutely. All right. Thank you, Cassie. And then finally, Mary Beth, so you have a background in nursing. So interested in a little bit more about your background and how you got to the American Urological Association.
Well, thank you for having me on this panel. Yes, I come from a long line of nursing. I'm a little bit older than you all, more mature, I should say, than any of you. My career has spanned hospital nursing, home health care nursing, clinic nursing, you name it, I've been there. The only thing I don't do is children, and it's just that all I do is carry around kids all day long in the hospital. So that didn't work out for me. So, but I have made a lot of contacts as I was going through, and being able to work with a number of folks. And this tells you how old I am. That's when To Err Is Human first came out. And we started to look at quality in a very different light, and started questioning why things were happening that shouldn't be happening in the hospitals. So I ended up going to work with an accrediting body. I've worked with two over my career. One was the American College of Radiology on their mammography accreditation program. And the second one was with URAC, doing their accreditation and setting up their program for measurement and the like for specialty pharmacy. And that's where I started to get involved with PQA. So again, you know, the way I look at it is, yes, I was a nurse, I was a floor nurse, and I could work very well with one-on-one with patients and do good for one patient at a time. But when I found that I could work directly with a large population of people, that really started me thinking about moving to a quality at a national level. And I ended up doing some work with, like I said, with the American College of Radiology, and worked with the FDA, and started working with CMS, and started working with ARC, and got a lot of connections through there. And a lot of those connections brought me to where I am today with regard to my current position at the American AUA. American Urological Association. So again, it's the networking thing that I want to stress here, that, get as many experiences as you can. Reach out to any of us on the panel. I think we would be thrilled to, help you along in your career endeavors. I've done a lot of mentoring and I still do mentoring. So if you're interested in doing some of that, I'm happy to have you.
All right. Thank you, Mary Beth, for that offer. Appreciate that. We're going to move on to another topic now, very related to what you all have been talking about, but I would like to know a little bit more about how each of you have been involved with PQA. So I'm going to start again with Nicolette. So Nicolette, this could be either like during your fellowship, if there was something particularly significant you wanted to highlight from your fellowship, or even in your current position with NQF, how you have worked with PQA.
Great, thanks. So I'll comment on a couple projects that I think helped shape my career trajectory during the fellowship, and then I can make a couple broader points. But first, I think during my fellowship, being involved in the Access to Care Roundtable, which is to develop a framework for medication access and determine which quality measures could be used at various points in that cycle. It involved a lot of research components, like an environmental scan of the current literature and available quality measures, as well as convening a diverse group of experts to reach agreement on a conceptual topic, a newer topic, and to really help lead those types of convening. So really appreciated the ability to work with thought leaders in their respective areas, which I think is a significant opportunity of the fellowship program. And then the second initiative I wanted to comment on was the ability to design a student cross-departmental competition where universities competed and put forth ideas and business proposals to address a key issue in healthcare quality. So I was able to be involved in, A to Z design of the prompts, partnering with funders, the operational components, and communication, creating judging rubrics. So I think both of those experiences involved problem solving, creativity, thinking strategically, finding common ground between different viewpoints. And I found I was able to leverage my core background in education, but also challenge myself and grow in new areas. So I think just a couple general closing points about, the fellowship program is that I think it's really unique in its ability to help foster leadership skills related to association management, and then also being centered in the DC area, I found really a motivating atmosphere. I think PQA, the team itself, was really supportive and collaborative. I don't think it's common to be able to work at that point in your career with leadership and members of the executive team. And it was also really great to be able to connect with other fellows at the other pharmacy associations to have a peer network while completing the program. So those are a couple of things that stood out to me. And then I know NQF and PQA are also, stay connected today. We have, numerous folks from both organizations on different panels and work groups and committees. So I will say quality is a small world, and I know I've appreciated the opportunity to kind of stay involved and to continue to connect with folks at PQA.
Yes, quality is a small world indeed. Thank you, Nicolette. Appreciate that. Hannah, same question for you. How perhaps do you interface with PQA today, or anything you might want to specifically highlight from your fellowship?
Sure. Oh gosh. So first, just like second everything that Nicolette said, it was a really, really great experience for me. I was the fellow right after Nicolette, and part of what attracted me to the fellowship in the first place was when I looked at the previous fellows, every other fellow had an extremely unique experience while at PQA. And not only that, but when they had left PQA, they had all ended up in different parts of healthcare, which I think is really special about this program. It told me two things about PQA when I saw that. The first is that the things that you learn at PQA are so transferable to almost every sector of healthcare. Quality is so central to basically everything throughout the healthcare spectrum. And the second, that PQA would be full of people who would be supportive of my journey and in making sure that that what I wanted to learn, I would be able to accomplish while I was there. So during my time with PQA, I rotated through a bunch of different groups. I spent some time with the measure development team, with the implementation group. I did some stuff in the academic affairs space and board oversight. But I think what was most formative for me was when I spent time with the research team. So while I was there, I worked on a couple of projects related to social determinants of health, which I know is everybody is focusing on right now. But when I was working on it, it was still kind of a new space, and there was really a paucity of literature out there. And so some of the work that I did with PQA at that time started to highlight some of those health disparities and some of the lack of literature in this space. And it certainly informed my decisions for the next part of my career, taking a role at a company that is so focused on a specific demographic in the New York marketplace, primarily low income members and people who just have a lot of social determinants that they need to kind of battle against in order to achieve the same health outcomes as other people. And so I would say in my role now, I have less interaction directly with PQA, but quality is such a central part to managed care. In developing benefits, I need to be constantly thinking about, are the benefits that I'm creating equitable to our population? Are they developed in a way by which everybody can achieve those same types of health outcomes that we want to see for our members? Are they going to produce quality for our beneficiaries? So I think, to me, PQA is this great connector. It spans quality and it connects people and organizations across the healthcare spectrum with this kind of central idea of quality and improving health outcomes for everybody.
The great connector. I like that. Yeah, it's a good one. All right, Cassie, how about you? How have you and your organization been involved with PQA?
I'm gonna first off tag with something that Hannah said, which is the quality is this great connector. But I feel like that's been one of my drives for, getting involved in quality at all. When I worked at the pharmacy, I was helping one customer at a time. I was solving their problems and going holistic to help a community, to help a population it gives you the feel goods. And so as a result of that, when we all are meeting and talking and working together, we're coming up with these great ideas, which goes back to the social determinants of health. We're trying to figure out solutions to solve these things. So feeding back into what I have, been involved with PQA. I've been involved with PQA at least for 8 years. I was not a fellow. I was just getting involved in measure testing. So after, PQA had gone through the process to say, we're going to try this to determine different ways to measure quality. I would come in with the data and say, okay, this is what it looks like. And then we would, come up with ideas in terms of helping with does this make sense? Does this feel like a good way to measure something? So I was involved a little bit more with the after, behind the scenes when we start getting into the real world of things. And so as a result of it, that led into my experience on the DIAC and the temp committees, which are getting further up that chain to start helping with the ideas of determining how to build those measures or coming up with those measures, from the beginning, as opposed to testing them on the back end. And it's actually, I actually worked with Nicolette when she was a fellow at Humana. So I am pretty familiar with Nicolette. To be quite honest, I've worked with a lot of different fellows, but it's a great networking opportunity. And through those networking opportunities, I've also generated posters that have been presented at the conferences. So, it's a different place to allow you the opportunity to figure out how to help the most people, because all we're wanting to do is, change the world. You want to make a positive impact on the world. And one way to do that is to, get involved with PQA. You're around like-minded individuals and everybody's just willing to give, help. And so that's networking, hands down. Networking is, great with PQA. It's kind of why I've kept going forward in my work with PQA is because of the networking. The people are great, all together. Everybody wants to change the world for positive. It's, I hate to say it, but it's, it's the reason that PQA is here, right? To help us all.
Yeah, we can't change the world alone. So I'm definitely hearing the networking theme loud and clear here. Mary Beth, tell us a little bit about your experience with PQA as well.
Okay. Yeah, I have a little bit of different experience than the others here, because I have been in quality for so long. Like I had mentioned before, the To Err as Human came out, and Don Berwick was very much into patient safety, which was not on the radar at all for all of us in the profession of nursing or in medicine for that matter, and kind of changed the way we looked at things. So, I did a stint at the National Quality Forum as well, and got to know a lot of the national leaders. And, part of my dissertation was on the National Quality Forum and how to work with people wanting to do quality improvement through measurement. So I ended up doing some of that and went to URAC, where they were starting a specialty pharmacy accreditation. And my task at that point was, as the VP there, was to provide or get measures into the program somehow that we would be judging on how well or what the quality was of each specialty pharmacy. And instead, in my haste to get it done, I found PQA, and they were the ones that were developing the measures. And I thought, why are we recreating the wheel? It's not worth it. So we had a little discussion with the PQA, drew up a licensing agreement, and started using the PQA measures in the URAC accreditation program. So that's kind of where I got into working with PQA. Then they wanted something in return, of course. What also was for me to work on their quality metrics expert panel to evaluate some of the measures that they were looking at and to improve them. So I helped with a lot of others in the field that worked specifically on this. So I have to agree with what everybody says about networking. What I'm going to say is that also not only network with PQA folks, but also expand your network out to NQF, out to some of the federal agencies, because those are where the opportunities come from. And if you're particularly interested in research on quality, ARC, it definitely is one area that you want to network with. So.
All right, perfect. Thank you, Mary Beth. I want to pause here for just a second and remind our audience to send your questions to us using the Q&A box. I've seen a couple of them come in here, and we're actually going to take one of these and make it a combo with our next topic. And we're going to talk to our panelists about their current positions and how they specifically interface with quality. You've heard some of that and what they've shared so far, but I'm going to start with you, Cassie. So just to review for everybody, you've been at Arkansas Blue Cross Blue Shield for about 2 years. And you've recently started a new position as Director of Government Programs Clinical Quality Analytics. So first question, tell us a little bit about that role, especially as it relates to quality. And then the combo piece here is, what advice do you have for upcoming graduates who may be interested in a position like yours?
So the first question, so my role is based off of the government programs and generating information related to the membership that Arkansas has to determine where our members are as it relates to quality measures. So particularly for medications, medication adherence, statin use in persons with diabetes. We work a lot with identifying the members who are struggling to, have those great outcomes, right? So we have to do things particular to education of our providers. We have to do things particular to education of our members. And you also have to, tie into the social determinants of health, particularly health literacy. Unfortunately, a lot of members in my populations are low income or they are older, and that does a little bit affect their health literacy. So we are talking a 5th grade reading level. And so We do a lot of work related to education of our members, education of our providers, identifying the members, figuring out the actual social determinants of health and their barriers that are preventing them from completing what they need, particular to picking up their medications or taking a statin. There's a lot of other quality measures out there, but we look at the member as a whole and try to figure out what we can do to help the member do what they need to so that we can prevent those preventable, episodes, going to the hospital because their blood sugar got low. They weren't taking their medication as they should have. What can we do to facilitate that kind of, on the holistic scale, obviously, because we are not calling one person at a time. But yes, and so in relation to upcoming graduates and, getting to my current position. So my position focuses a lot on programming, being able to program transactional data into a holistic member picture. And that's just a skill that, to be quite honest, I didn't learn it in college. I didn't learn it in school. It was kind of an on-the-job training kind of situation. So if you want to go in the route of analytics, I suggest learning some form of programming, particular to Python, R, or SAS. Those are your big hot topics at the moment. It could change in 5 to 10 years. It always does. But so I didn't really learn it in school. I kind of got my job and kind of learned it all on the fly. So yeah. It's just about when you're in college, exploring everything that you want to do while you have the time, because when you go to the real world, you get a job and sometimes it, puts you on a trajectory. And that's kind of how I got my job here. I got a job at Humana, learned how to program, and, sky's the limit with programming. So I'm going to reach for it.
Absolutely. Thank you so much, Cassie. So Mary Beth, I'm going to have a similar question for you here in just a second, but we did get an audience question. Someone was curious about ARC that you mentioned. Could you tell us a little bit more about what that is?
Yes. ARC is the Agency for Research and Quality. It is a federal program, and basically their focus is on research, data collection, also they do a lot of educational webinars and things like that. And also they have annual meetings that they go to. But again, they're focused on quality. And, when I was there, Carolyn Clancy was the MD that was the CEO of, well, I guess she was the administrator. It's a federal agency of ARC, and basically had the forward thought to focus in on healthcare and focus in on specifically how to improve healthcare. And again, she was at the time when she was working with Don Berwick, as well as Janet Corrigan, who was a part of the letting 1,000 flowers bloom in terms of the measurement, because there was no such thing out there at that point. But it was a wonderful experience. They're very versatile. They're research oriented. And again, it's part of the federal program that the government has put together. I hope that answers the question.
Yes, perfect. Thank you so much. If you have a follow-up question, whoever asked that, please feel free to drop it in the Q&A box. But Mary Beth, let's talk a little bit about your current position. So you've been at the American Urological Association for more than 3 years now. So can you tell us about how you interface with quality, specifically if it relates to medications, and then throwing in that bonus question, if you've got any advice for upcoming graduates who might be interested in a position like yours?
Okay, well, my position was after a long time in quality. So again, when I was starting out, I kind of made the trajectory of, okay, I really want to do something other than bedside nursing. I want to be able to influence more folks, more of the population, and improve quality overall at the national level. So I started off by making sure I had experience. And I have to tell you, experience of a clinician is top drawer. People are looking for that, including pharmacists, absolutely. And if you can expand your knowledge base and skill base and participate either in a survey development, I've participated in HCAPs. It's kind of funny because I mentioned it to some doc today, and he was saying that he does all the HCAP stuff. I said, well, that was my internship project when I went to ARC. So, but participate in survey development, participate in measure development, measurement refinement, measurement testing. That is very, very valuable right now. And particularly if you all have a pharmacist after your name, wonderful. That's even better. So again, I got here after a very, very long trajectory. I was in the hospital, like I had said, in the community, as well as at the national level at NQF, and then accrediting bodies as well. And you get asked to be on certain panels and whatnot. And I got to work with Joint Commission on a number of things. And then I got this job through a network. My contact at ARC came and worked in my stead before me, so at my position. So Hetty Hubbard was kind enough to recommend me for this job. So again, it's like the networking is very, very important. And expand your network. Don't just be narrow about it. Expand it to other areas in quality and in healthcare. And some of the non-traditional ones too. I've worked with industry as well, Pfizer and a few of the others, that they have opportunities for you all as well. You're very much in demand, put it that way. So.
All right, very good. Thank you, Mary Beth. Nicolette, let's go back to you. So you mentioned earlier you've been at NQF now since you completed your fellowship here at PQA. So can you tell us about your current role as Senior Director of Emerging Initiatives, how that focuses on quality, and if there's a piece of medication use quality in particular that might be part of that? And then what advice do you have for upcoming graduates who might be seeking a position like yours?
So in my current position, I think at a high level, I work with public and private sector partners, external stakeholders to assess and promote quality across various topic areas. What I really like about NQF and my role is we tackle and address challenging issues in our healthcare system that I don't think one organization on its own can solve. I think I saw also a question in the chat around, what does a typical day look like, or what does the day-to-day of positions look like? So I think that's kind of what my role is at a high level, but on a day-to-day that involves, leading various project teams to conduct a review of the current evidence base, bringing together leaders in different healthcare groups, whether it's payers, providers, purchasers, patients, to try to put forth recommendations on various topics, and then publishing and disseminating those briefs or reports or white papers with these recommendations and findings to try to provide guidance to the quality ecosystem in new areas and in new ways. To give you a taste of what some of those topic areas are, measurement attribution, digital quality measurements, measuring health equity, how do we measure and assess quality in rural areas that face different, significant healthcare challenges, and also challenges with the ability to measure outcomes themselves due to low case volumes and things like that. And also trying to move beyond just individual measures to look at more measure sets and measurement systems and how those are used in more value-based models of care. I also work on the Core Quality Measures Collaborative, which is a public and private sector effort to align quality measures that are used in value-based programs across the country. And the aim really seeks to address the burden of so many different quality measures and how they're reported in different ways and different models. And that work is jointly funded by the America's Health Insurance Plans, AHIP, as well as the Centers for Medicare and Medicaid Services, and has over 70 member organizations. So that's what I work on in my current role. I would characterize my role as a bit broader than, specifically pharmacy or medication use, but I think pharmacists and industry leaders and payers are really important parts of, these committees, and the measures that are related to medication use are included in many of these initiatives. So very much related. I think in terms of advice, I don't know if I have a lot more to add than others, focusing on, if you want to make a broader impact, really trying to connect with some of those individuals and organizations that are in those areas, whether it's at a national level, some of the national organizations, some of the specialty societies, but hospitals, like there's a lot of organizations that also touch on quality. It's very broad. I didn't practice clinically as a pharmacist after school, but I know there's a comment around, the value of being in clinical practice and having that on the ground experience. So I do think if you want to go to a residency route and have clinical experience and then move into quality, that brings a lot of, beneficial skills to advance into quality at a later time as well. So I don't think there's, one pathway, but those are a couple of my comments on both what I do now and maybe how to consider a career in quality.
All right, thanks so much, Nicolette. And then finally, Hannah, so similar to Nicolette, you've been at Healthfirst since you finished your fellowship. So tell us about your role, Director of Pharmacy Benefits there at Healthfirst, how it relates to quality and medication use, and then your advice for upcoming graduates too.
Yeah, absolutely. So I know I spoke a little bit about this earlier, but I would kind of characterize my role as breaking down into three main pieces. I design benefits, I implement those benefits, and I oversee them to make sure that they are effectuated correctly and compliantly. And I think quality is a core component to each of those key elements. I think whenever you work in kind of healthcare operations, quality needs to be at the forefront of everything that you do, because you can design the greatest benefit, but if you don't roll it out correctly, or if you're not thinking about it in the way that it will actually tangibly impact your membership, you might as well not have developed whatever it is that you've been working on. So in my role, I use quality to guide a lot of my decision making. When I'm looking at my population and looking at the disparities in health outcomes or the needs of specific populations, I use quality as my guide to determining where I need to invest funds, where I need to build up my benefits to best support my membership. I would say that managed care is a little bit like playing 3D chess, right? You have a lot of parameters that you're working within. You have financial constraints, you have legislative mandates and compliance that you need to work around. And at the same time, managed care companies are held to very, very specific quality standards by organizations like CMS and other government bodies. And those types of standards that we're held to also have huge financial implications for the organizations that we work with. So whenever we're developing benefits, whenever we are considering our business decisions and plans for future years, we're kind of using, again, that quality as our guiding principle for making sure that our benefits are equitable, to make sure that they deliver quality to our membership, to make sure that they're designed in such a way that will allow us to achieve those quality standards or exceed them as much as possible. So I would say managed care, it's quality every day, all the time, even if you're not thinking about it in the forefront of your mind, it's always there. In terms of advice for people looking to kind of get into this non-traditional space, so first I'll say, this is a great first step. Just being here on this call today, I think is a great step in that direction. Just exploring this space is so exciting. I teach a little bit on the side, and I always tell my students, a pharmacist degree is so valuable. It is your golden ticket to basically anywhere in the healthcare industry that you want to go. You are marketable in almost every industry. And the best thing that you can do for your career is just talk to people. I really think that's it. We talked a lot about networking today. I promise you that if you go to just about anybody who has an interesting job and you tell them your job is really cool and I would love to take 20 minutes of your time just to talk about what you do and how you got here, nobody will ever turn you down. And it is 20 minutes well invested, because now you have a better understanding of a part of the industry that you might not know anything about. And generally, I've always found that people in these types of interesting roles are usually very invested in helping other people get there. So nobody will turn you down for a conversation, and they will usually connect you to other people in their network who you can continue that conversation with.
All right, yes, very good advice. Thank you, Hannah. Some of those conversations, those exploratory conversations really can lead you to a lot of interesting places. So thanks for pointing that out. Mary Beth, we did get a question in the Q&A box here. I wanted to see if you could address this about expanding horizons and working with either the government directly or perhaps a government affiliated organization. Well, can you talk about the roles that healthcare providers, pharmacists, nurses, and others might have in the government or working with a government organization or entity of some kind?
Yeah, there are a number of roles that are available. I mean, I'm very familiar with ARC and CMS. They do have projects that they work on, and part of my project was HCAPS, which I worked with a team in order to develop, and CMS was the one that funded us. So we were able to get together and, work through that process. So, a lot of this is leading discussions with stakeholders and the like, and also working across agencies. So you get to know these folks, and then you get involved in some other projects. For example, ARC, I was originally in the CQIPS, which was the patient safety initiative that was going on. So we got to do a lot of patient safety initiatives, education, and the like. So, you start off as, helping and assisting, and then you end up really getting an education and getting exposure to a lot of other organizations, such as RAND, Harvard, a lot of those folks that work hand in hand with the federal government. So it's a learning opportunity. And the interesting thing is you take it all in and you make, you kind of make it your own, is how things go. I'm always a nurse. I always tell everybody I'm a nurse first. And then, and I got, even my dissertation chair said to me, he goes, "You learned everything about the federal government, but you didn't change. You're still a nurse." So, that's kind of my advice to you.
All right, thanks so much, Mary Beth. Hannah, we've had a question coming in here for you about working with social determinants of health in your research project. So can you describe some of the challenges that you faced during that project, and perhaps how you might have overcome some of them?
Yeah, absolutely. And I'll say I've continued to kind of work on similar projects. I now sit on a health equity panel with AMCP. And so this has really been kind of a very critical part of my career, spending time in this social determinant space. And some of the major challenges that I saw when I was working on this research project with PQA are similar to the challenges that I still see today, that we're still trying to figure out as an industry how to get around. The first thing is that a lot of data is just not available for a number of reasons in this social determinant space. When you're talking about social barriers and other types of health equity disparities and the data surrounding that, a lot of times it's very sensitive data. It's difficult to collect. It's not very standardized. A lot of things are self-reported, and sometimes the people who are reporting it don't know how the data is going to be used. So, for example, I work in the New York City marketplace, and we have a huge immigrant population who are very hesitant to tell us anything about their ethnicity because they don't know if it will have negative impacts on them down the line. There's people who have, or for example, another big area that we're focusing on is like transgender health. Very sensitive topic. You can't force anybody to tell you information like that. And so how do you standardize that data? How do you collect that data? So yeah, data collection and standardization and just availability of data is challenging. The second piece of that, kind of related, is that when you find organizations that are really effective in this space, it's often very proprietary. Healthcare is a competitive space to be in. A health plan is going to be competing with a lot of other health plans. And so I found in our industry, there's often this kind of protectiveness with your projects and your initiatives and the way that you're innovating until things become a little bit more widespread. And then you lose kind of that protective feeling for the types of work that you're working on. So I would say that the data, availability of data and the proprietary nature of a lot of the types of initiatives that impact this space are the main challenges for this. And so I don't know if I have a great answer. How do you overcome that? You you advocate, right? You advocate at a legislative level to try to improve these types of data collection, working with schools and educating pharmacists and other healthcare professionals who are coming up and how to have sensitive conversations with patients about this type of work is super important. I think it's a lot about building from the ground. We don't have great infrastructure for this type of work right now, and we're working towards it. And I think starting with those essential foundational building blocks towards a better state is probably the best way forward here.
All right, fantastic. Thank you, Hannah. Certainly challenges that have been around for a long time, and I'm sure we will all continue to work on together. So thanks for sharing. Cassie, I want to go back to you here we have time for just a couple more questions here. So I would say among our panelists today, you may have been the most unlikely to end up in quality. So just curious if you could speak a little bit more about your mathematics background and when did quality really start to make sense for you? Was it the combination of working in a pharmacy at the same time? Can you tell us a little bit more about that?
Yeah, so I did spend 10 years at a local pharmacy. And so I was counting pills and helping customers and, answering questions. And through that, along with my mathematics degree, because I love math, it just turned into this, what can I do with math that I enjoy and I completely understand? And how can I help the people that I help? I enjoyed going to work every day and helping my customers when my customers would say, thank you, I wasn't going to be able to pick up my medication this month. I was going to pay my electricity instead. Those are the things that I don't know that if you're not actually in the trenches, you don't see that every day, right? So I saw that every day and I felt like I was making a difference. And, with my math degree, it was great. I did statistics. I thought I wanted to go work for big pharma and get into research testing. And it kind of morphed the longer I was at the pharmacy. I enjoyed reading that, but it was more about, if a health payer starts putting notes on the label that comes out with the prescription that says don't forget about warfarin and simvastatin not being taken together because they interact, those data points sometimes come from the payers and not necessarily from the manufacturer of the medication, because the manufacturer doesn't know necessarily what meds you're taking together, but the payer does. So the payer puts those notes out there. And so I got interested in, well, those things that the payers are putting on those labels for the customers, are they working or are they not working? And so that kind of turned into, well, maybe I can get into public health and work for somebody to do something so that I could then, get to the next step, which is, helping more people and applying the math to it, because I wanted to find out, did it actually work, whatever it was we were trying. And so again, that's how I got into Humana. That's where the programming came in, and the rest is history.
There you go. All right. Thank you, Cassie. We have time for one more quick question. I'm going to put this one to Nicolette. It comes from our audience here. They're wondering about the pharmacist licensing exam, so the NAPLEX, and how you balance that with your fellowship responsibilities. So can you give us a brief answer to that, please?
I would be happy to, but you might also want to punt it to Hannah, because I'm probably not the greatest example. I will say I was, interested in the fellowship and that work, that I will be honest, and I did not take my NAPLEX following school. So Hannah might have a better answer from that perspective. But I think my advice on that is try to take it right away while the information is fresh, cut out time to do it, and knock it out right away. There's still this part of me that's, I'm going to go back and submit my hours and, do the NAPLEX and do the law exam. But I think I was fortunate in my pathway that that's not something that I chose to prioritize because it wasn't required for the position at hand. But overall recommendation is to do it right away, cut out time for it, and get it done.
Yes, fantastic advice. Thanks, Nicolette. Hannah, what do you have to add here?
Sure. I'll just add that most programs are generally pretty supportive of you at getting that licensing exam done pretty quickly. I also will admit that I waited. So I got it towards the end of my fellowship. The other nice thing about being in kind of a non-traditional space is that it's not always a requirement that you're licensed. I would still highly recommend that you get your license. I think it's worth it. But you usually have a little bit more flexibility around the timing when you're in a non-traditional space.
All right, and with that, we will need to wrap up our panel discussion. Thanks to all of you for being with us today. I really appreciate all of your insights and your unique experiences, and to the audience too for asking us very great questions. So thanks to all of you as well. And we are going to share a little bit of information with you to close out. So we will bring our slides back up. And there they are. And I am going to drop some information into chat here in just a second so that you can have this as I talk through a couple things to wrap up here. All right, so let me back up just 1 second. All right, so we've been talking about a lot of different non-traditional career opportunities in quality today. And we here at PQA do help to build the next generation of leaders in healthcare quality. So we offer a variety of opportunities for healthcare professional students and also some postgraduate opportunities. And in fact, applications have just opened for 3 different programs. The first of those is the PQA Executive Fellowship, which you heard Hannah and Nicolette talk about today. That's a 12-month program, and it allows for collaboration with a wide variety of stakeholders that you heard about multiple times today. And that's at the national level to impact the quality of care that patients receive. And second, we do offer a summer executive internship that is sponsored by Pharmacy Quality Solutions, and the program provides an experience in nonprofit association management with an emphasis on healthcare quality. And then third, we do provide advanced pharmacy practice experiences, or APPEs, which are experiential education opportunities for our student pharmacists. And then finally, soon, our MPH practicum applications will be opening, and that program allows participants to contribute to ongoing research initiatives. And if you check out the chat, you can see a link there to a brochure that will give you more information about all of these programs. It will also link to the PQA website with even more information, and also to the applications for each of these opportunities. Wanted to go through a few key dates with you, just so you know what those are. So what you see now is the timeline for our executive fellowship application process. So as I mentioned, the applications are open now. They are due on December the 1st. PQA will then hold virtual interviews in mid-December, and then invite select candidates to participate on an in-person interview in early January. And then selected candidates will be notified of their status by late January. And then next, for our summer interns and APPEs, we do have a similar timeline here. Applications are also open now, but the due date is later for these opportunities. That is December the 31st. Interviews will take place for select candidates in February, and then offers will be extended in March. And then for our MPH practicum program, we have 2 recruitment timelines here. For the spring rotation, applications will open in October. They will be due in November. And then interviews will take place in late November with offers made in early December. And then the summer rotation, applications will open in February and will be due in March. And then interviews for that will be in late March with offers in early April. We do encourage you, if you are interested, to apply to any of these programs, or if you know someone who may be interested in your network, we encourage you to share these opportunities with them as well. PQA staff is available to answer questions you may have about any of our student and professional programs. You can email us anytime. I did put the address in the chat. It is education@pqaalliance.org. And then to wrap up today, I would like to invite you to please join us next month for a Quality Essentials webinar that will be on Thursday, October the 20th from 1 to 2 p.m. Eastern Time. We will be continuing the conversation about quality measurement fundamentals and PQA measures, and we will focus on insulin persistence for this webinar. You can click on the final link in chat to register for the webinar, and we look forward to seeing you then. Thanks once again, everybody, for joining us today, and I hope you have a great day.